pain in your legs, whether they ache in bed or whether they have tension when you're walking, or it's affecting your hips, you have hip pain, or maybe it's just that you don't like the appearance of your legs and you want to change the tone and the quality of the legs. Whatever the reason, you're looking for a simple solution, and this is what this video will show you. All you need is a rolled up towel to start off with. So welcome to week 2 of the summer reset, and in this class we're going to be focusing on the legs and the hips. So last week in week 1 we focused on the feet. If you have not watched that video, hop back and watch the video. You don't have to do them in any particular order, but it's a great one to start the foundation, and I also show you how to roll up the towel. I'll link the video on the screen for you now. So hello, my name is Catherine. I'm a block therapy instructor and fascia alignment coach, and I use block therapy's practices to support myself when there's ever any aches or pains or tension throughout my body. And I also support people through classes and one-to-one support so that they can start moving with ease and get rid of those tensions, those pains and those aches as well. So let's get started in the belly position. So as I said last week, we always start in the belly position to connect to that breath. And I want you to notice how your legs are feeling right now. You can lie forward, do a bend forward just to notice the legs, have a walk around, or just feel how they're feeling right now. And then after the class, come back to that to notice how they're feeling after you've done the positions. So we want to be doing this on the bed or the ground, or you can sit in a seat to do this as well. So just find that belly position, either lie on your back or in a seat, and then you can lean forward and connect to that diaphragmatic breath. So you want to be always breathing in and out through the nose, in for a count of 4, feeling that belly expand, and then out for a count of 6, feeling that belly going small. Imagine that belly button's going to the back of the spine. So let's get started in that belly position. So coming down to the mat, slowly lower yourself down, finding that belly button area, and then stay up on your elbows if you can. If you're hunched forward and can't support your upper body, just get some pillows or cushions to be able to support you, or if you can, come all the way down and lie flat on the mat or the bed. And now let's connect to that breath. So breathing in for a count of 4, feeling that belly expand, and then breathing out for a count of 6, feeling that belly going small. Imagine that belly button's going to the back of the spine. And you just want to keep that breath flowing. You may feel pain, pressure, that's all normal, and the pulse. So the pulse is the aorta. The pain and pressure can be due to inflammation, undigested food, or waste that hasn't been eliminated. And as long as you can breathe in this relaxed way, you're helping to heal the body. If you take yourself to a place where you can't breathe in a relaxed way, then just back off, loosen the towel, do it on a bed or do it seated or on your back. Just change it so that you can still breathe in that relaxed way. If you're not connecting to too much pain, you can start to search for it. So in all the block therapy classes, we're searching for pain so we can release it out of the body. And you can do that by dropping a hip, so dropping the left hip to one side and twisting over to the right. You can make adjustments with your leg for balance, and you can come down or stay up on your elbows and searching for that pain, and then slowly moving to the other side. So any movements you do, any searching is just done very slowly so that we don't miss any areas of restriction. And when you find an area that gives you more pain or tension, you can stay there for a few breaths or until it eases. So we stay in these positions for a minimum of 3 minutes, but you can always do more. And once you've done that, just place your hands underneath your shoulders and exhale up and out of position. Tightly roll up the towel again. You can get that elastic band to keep it firm, or you can loosen it if it gets a bit too tight for you in certain positions. So now we're going to get to the hip flexor. So we're going to do both sides, but if we start on the left side, find that hip bone and the towel is going to go underneath. It can be directly across on a slight angle, but just directly underneath that hip bone. And we want to do this on the floor or in a bed. If you're doing it on a seat, you'd sit on a chair and then you'd add pressure and push down into the hip flexor area. Doing it on a bed or on the mat, straighten out that left leg, bend that right leg to the side, find that hip bone, so just underneath it, and then stay up on your elbows if you can. Alternatively, you can come all the way down, whatever feels right for you. You want the hips to be parallel to the bed or the mat, and then connect to that breath. So breathing again, in and out through the nose, in for a count of 4, feeling that belly expand, and out for a count of 6, feeling that belly going small. You can also start to search by coming up onto the toes, lifting that leg up. You can lift it up off the floor completely, And then angling the foot very slowly to the left or the right, searching for where that pain is, still connecting to that breath. You may feel some shaking, that's normal, that's waking up those cells. And again, as long as you can breathe in a relaxed way, you're helping to heal the body. So this area can be quite bulky, so you may not feel much pain, so you may want to sort of toggle forwards and backwards to help sink in it. And the more you do these positions, the more you'll sink deeper and access different layers and melt away those fascia. And you may feel some blood flowing through there, which is opening up the blood and oxygen so it can flow down into the leg. And then once you've done that side for 3 minutes, place your hands under your shoulders and exhale up, and then tightly roll up that towel again and do the other side exactly the same. So next we're going to do the quads, so anywhere from where we just were with the hip flexors all the way down to the knee. So exactly the same, so if you're sitting on a seat, you would just add pressure, you can use your arms, add pressure and lean into it. And if you're doing it on a bed or the floor, it's just the same as we did with the hip flexor but in a different position. Now the whole of the leg needs to be covered, so you can do various positions, whatever feels good for you, where the pain is. And again, you would put that right leg out to the side for support, stay up on your elbows, or you can come all the way down. You can lift the toes, and this time you can even bend the leg. And for me, that's where I access more pain, when I bend the leg. So feeling yourself where the pain is, connect to that breath, in for a count of 4, feel that belly expand, out for a count of 6, feeling that belly going small. And then you can search to the left and you can search to the right, just very slowly making those movements, finding where the pain is for you and breathing it out of the body. And then once you've done your 3 minutes, place your hands underneath your shoulders and exhale up and out of position. So next we're going to do the hamstring. So behind the back of the bum, all the way to the back of the knee is the hamstring. So the towel's going to go there. So if you sat on a seat, you can place it anywhere and you can sit on it and add that pressure, or you can do it lying down or sitting up, just finding in between here, anywhere. Add the other leg for extra pressure and you can lie down and do this. Or if you want to bend the opposite leg, this just adds a little bit more pressure, and then you can lean forward and move and find where that pain is, searching for it, making some movements with the foot, lifting the foot up, flexing the toes, whatever you need to do to search for that pain. And remember to connect to that breath. The breath is helping you to relax. It's also helping you to make sure that you're not accessing too much pain, because you always want to be breathing in that relaxed way. If we hold the breath, we're telling our body that we're not safe, and we need to be doing this, persuading the body to release rather than forcing it. And then once you've done your 3 minutes, just move over and do the other side. And then the final position for this class is going to be the calf. So you can do this the same as we've just done. So again, it's anywhere from the back of the knee all the way down to what we did last week, which is the Achilles, so in between here. You can place the towel underneath, add some pressure with the other leg, you can lie down, or to get in a little bit deeper, you can do this on your knees, making sure that foot's straight, placing it in between, and then sitting back, similar to the Achilles position, it's just higher up, and then you can lean to the left or the right, lean forward and add that pressure, searching for that pain, connecting to that breath. Can be a lot of pain in the calves, getting further away from the diaphragm so it becomes more frozen. So you want to be spending a lot of time here, so you can spend more than 3 minutes. It really helps to release these calves, because a lot of pain and tension can be in these calves due to the way that we're standing, shifting our weight to one side, and we don't have that alignment. And then once you've finished your 3 minutes, you can just do the other side as well. So notice now how you're feeling in your legs. You can stretch them out again, do a forward bend, feeling how those legs are feeling. Go for a walk and notice throughout the day. Also notice inside how you're feeling, because you've been connecting to that diaphragmatic breath. So if you enjoyed this class, I do have online classes where we are in position for the full 3 minutes, and I guide you through various positions. There's a link in my description to tell you about the online classes, the in-person classes, and also one-to-one support. Next week, for week 3, we're going to be focusing on the core. When we collapse in, our shoulders round forward, we collapse into the core, we lose the space here, and that can cause a lot of tension in the back, the upper back, and we want to be opening up that body so that we can sit straighter but the organs have more room. So thanks for joining me, and I look forward to seeing you soon.